When patients come to see us because their teeth are very broken down or they've lost many teeth or the teeth that remain are very bad, whether it's due to gum disease or decay, one of the treatments that we can offer is basically what we call teeth in an hour, or all-on-4 treatment. Teeth in an hour, all-on-4 was a concept that was designed in Europe many years ago, and it's been tried and tested over that time. And what it is removing of the bad and the broken down and infected teeth. It's placing between 4 and 6 implants, and then it's placing a bridge immediately at the same time. So what you're doing is you're restoring the entire mouth basically at the time of treatment or the time of surgery. So there's no delay. It works extremely well. Case selection is very, very important, but all-on-4 treatment is a great way that to replace all the teeth if there's limitations in time or patients don't want to go through the phase of having dentures. Traditionally, if people had broken down teeth or were unable to retain their teeth, the treatment of choice would have been always removal and dentures. And we know historically that clients don't like dentures. They get problems with it. They rub on the gums, they basically get loose, it's difficult to chew, it's difficult to talk, it's difficult to taste. All of those reasons are a reason why all-on-4 treatment or implant retained bridges is an excellent way to replace teeth when they are badly broken down. In this case here, we have a patient that's come to see us. He has one of our favourite patients, actually, a very charismatic person. He's come to see us because he's got problems with his upper denture, so his denture's loose. And also when you look at his bottom teeth, he's actually lost or losing most of his teeth. You can see he's got this upper plate and he's got 5 teeth remaining. Out of the 5 teeth, he's got 2 teeth that have decayed, the black areas here and here, and they're about to be lost. If we look here from the side, you can see the decay coming through from the side on the right hand side, some gum problems actually down here, and on the left hand side you can see the same problems actually occurring on the left hand side of the mouth. So we can't retain these teeth are going to be lost. There's only 5 of them. A person cannot chew on 5 teeth when we should have between 14 and 16 teeth. To have 5 front teeth and no back teeth to chew on makes it quite challenging to actually chew teeth. We're already going to lose 2, so that relieves 3 front good teeth left. It's really not enough teeth to be able to chew comfortably. It usually leads to things like digestive problems, of course, aesthetic problems if you've only got a couple of teeth at the front. So what we're going to do here is lower all-on-4 treatment, and on the top we're just going to replace his denture with a brand new denture or a brand new plate that fits better, and therefore will give him back his function with the lower all-on-4, but give back the aesthetic, so when he smiles everything is in harmony and balance again. We're using technology here when we're placing implants to use computer-guided implant placement. And computer-guided implant placement means that we can use a computer system to tell us where the bone is, where the blood vessels, nerves, arteries are, in order to place the implants in the perfect position. So here we're using a 3D scan to plan where the implant should actually go. There's the upper plate. You can see the upper plate's a full denture, new teeth. Again, colour matched. We've used jaw tracking here to make sure that the bite is going to be perfect for this patient. We've used a very small plate. You can see how we cut away the palate. We've actually only got 1 molar here rather than the standard 2 molars because we want a very small, comfortable plate actually for the patient, and that was his request, to have a very small, comfortable plate. On the lower here, we've actually done it all on 5. We've got 5 implants here. You can see the screws, and basically what's going to happen is we're going to take the teeth out, we're going to place the 5 implants in, and then we're going to screw this bridge straight in at the same time. This is the treatment here. This is the day of actually placing the treatment, and you can see a photo here of the patient. That's the new upper plate. I'm going to zoom up on this photo so that you can see it a bit closer, but we've got a full upper plate here with an all-on-5 lower. This was all delivered actually on the same day. The most important thing with this type of treatment is a lot of planning when the patient's not here, so that when we do the treatment, it probably only takes us an hour to actually do the treatment, but it's so well planned that we can actually deliver great cosmetics and great function in a very short period of time.